Hi, everyone. We are going to get started in just a second. I'm going to give it a little bit to let everyone get into the room and situated, and then we'll get started. All right. I'm going to go ahead and start for today. My name is Erin Mayberry, and I am Director of Community Engagement here at Rethink Behavioral Health. And I want to start by welcoming you to another Startup Community webinar. We are very excited to start a sub-series within this startup community where we are actually going to be talking with BCBA entrepreneurs like yourselves. So we have a practice spotlight series that we're going to be doing as part of this overall webinar series moving forward. And I am really excited to have Dr. Jennifer Agganis with us today from ABA Foundations in Florida. She and I are going to do more of a conversational style presentation today. So there won't be any slides, but all of this will be recorded and you will have access to it following the webinar. So if you hop off, drop off, miss anything, show up late, you'll be able to go back and listen to the entire conversation in full. For those of you who may have gotten here but aren't really sure what Rethink's startup community is, it is designed for BCBAs who are considering or have just started their own ABA practice and just want additional networking opportunities and resources as a new business owner. We have a Facebook user group that you can be a part of, and we also have lots of other webinars and events that you can participate in. So I will be sharing a lot of resources at the end of the webinar today that you can access after we jump off. A few housekeeping things before we get started. You do have the option to chat with panelists, and you do have a Q&A option. As we're talking, if you have a question, I encourage you to use the Q&A to type in your question. We will try to sprinkle in some of those questions as we are going today. And at the end of our discussion, if we have any additional questions, we will address those with any time that we have remaining. If you have any issues with audio, things like that, feel free to chat instead of use the Q&A, but you are all muted. So if you do need to communicate with us, you can do that via chat or the Q&A options. So now I would like to welcome Dr. Agganis, and for just a quick overview and to let you know who she is. She is founder and chief clinical officer of ABA Foundations. Like I mentioned, they are based in Florida. And Dr. Agganis graduated from Simmons College in Massachusetts with a degree in behavioral education. And she received her BCBA certification in 2003. She also received her doctorate in education from Florida Atlantic University in 2018. And she's been working with individuals on the autism spectrum since 1999. Her company, ABA Foundations, has been serving communities in Martin and Palm Beach counties in Florida since 2015. For those of you who may not be familiar with ABA Foundations, they do provide services to families and to children diagnosed with autism and their families. And they also provide services in home, school, center, and community-based settings. So welcome, Dr. Agganis. I'm really excited to have you as our first practice spotlight. I think what we can start with is maybe just kind of walking us through your background as a BCBA. So how did you get started in the field? Right there.
Excellent question. So I think it started back when I was in college. I started out in speech and language pathology. So I have a background on a 4-year degree in that. And I was kind of at a crossroads in my life to decide, did I want to continue in speech or did I want to do something different? I was hesitant because you have to go through this very rigorous clinicals. And I'm like, before I make this big decision, is this really what I want to do? And at the time I was nannying on the side for a little guy who was nonverbal and had diagnosis of autism and was very interested in his outcomes as he was developing and growing, and very interested in the fact that when I took him to speech and language pathology services that he was receiving, they couldn't get him to sit, they couldn't get him to attend. He was engaging in problem behaviors, which was hindering his ability to be able to learn. But then when I took him to this thing called ABA therapy, which I'd never heard before in my entire life, I was just amazed that he was sitting, he was attending, he was making speech sounds for things that he really wanted. He was pointing, and I was hooked. I'm like, what is this? So I set out to kind of find out what more about ABA I could learn, and I kind of just stumbled into it. I had a person that ended up becoming my friend who was a BCBA in the community, and she provided in-home supports for kiddos on the autism spectrum. And this is going to very much age me. Back before there was even this thing called Board Maker, we took Polaroid pictures. Oh my goodness, of this little girl's favorite things. And we created essentially like a peck book for her. And I remember like putting the words on the bottom and handwriting them with a Sharpie. And so I had to make all these materials for this BCBA. So that was kind of like my beginning. And then I decided to go back to school for it. And I went to Simmons College. And so I kind of just fell into it and I worked full time in the field. I was in Massachusetts and I drove an hour and a half to work with a client for 2 hours, but I didn't care because I was being mentored by amazing clinicians at the time and learning a lot. So I have a background in speech and language, a background in with a minor in sign, because I was also partially interested in deaf education at the time. And then from the University of that was all from the University of South Florida, and then Simmons, and then I went back to school to get my doctorate at FAU in exceptional student education with a minor in reading instruction, specifically for kiddos that are struggling with reading, because that is my other love is I love reading and literacy. So that's one of my joys as well. So that's kind of my path in a very brief overview, becoming a BCBA. So it will be 20 years this June. I was looking at the time frame, like, wow, 2003, 2023, it's 20 years. It's crazy. It goes by very fast.
The time does fly. You and I share the Simmons College background, and
Yes.
I think as a lot of people on the call can relate to, just kind of stumbled into ABA, and that was not my intention at all either. When I started, mine was early childhood education. I wanted to teach kindergarten.
Oh, love it. Love that age.
At what point in your journey did you decide that you wanted to start your own practice?
Yeah, great question. I think I have always been in the position where I've always just kind of wanted to do my own thing. Now, granted, I've worked for large companies. I've worked for grants funded through the Department of Education. So I've been in a couple of different settings for that. But I feel like I've always kind of wanted to do my thing. I love consultative services. I love being able to work very closely with families. You'll find out soon that opening a center is not at all part of my business model. And initially did not want anything to do with an ABA center. And I did it kicking and screaming. I absolutely love doing in-home supports and working with families, going into the communities, doing covert audio coaching with families, with earpieces in my ears, and the family is dealing with a challenging behavior in Walmart, and I'm talking them through it because they need to learn to do it on their own, but I'm there to support. So my point is that, I think in my path, it wasn't really a point in my life where I was like, I'm going to just start my own company. It was just kind of always there, and I always kind of wanted to do it. Yeah, so I feel like, and which we'll also talk about in a minute, the needs changed, needs from staff, the needs from my current clients changed, and kind of just growing with them and hearing them and listening to them. It was kind of something they wanted also.
So you have this passion and you have the obvious need in the community. When, as a BCBA, do you know, okay, now I'm ready to start? Is there that moment in time where you can just look back and say, now's the time?
Yeah, great question. I think that there is a time when, so in my mind, I always when I see that I want something, or I know that I want something, there's a difference between I'm ready versus am I really ready to do this? I mean, I've always been like that my whole life. Like, when I found out the world behavior analysis, I'm like, I wanted to be a BCBA like right now, but I have to work towards it. I'm not ready yet. I need to learn these things, but I want to hurry up and learn it now, but it takes time. Same thing with the business, is that you've got to have your pieces ready and intentional to be able to make that next big step. Because keeping in mind that it's a business, yes, that you're making a decision to do and provide, but it's a service that you're providing. So it's families' lives, staff lives you're impacting. It's not just your own, which I'll talk about that again later as well. It is a very self-sacrificial position to be in. And I'll talk more about, I don't want to get ahead of myself with it, but there is definitely a point where you make that mental decision that, yes, I want to do this, but I need to have these things lined up first to be ready to do it. I hope that helps answer the question.
It does. And I think it leads probably to an obvious next
Yes.
question. What are those things? What
Right.
are the considerations that you need to be aware of as you are
Yeah.
starting?
So first, deciding where you're providing those services is a big piece. ABAF started just with consultative support in the homes and the communities, a lot in the schools. Creating relationships is huge, which you'll find is inundated throughout our conversation today. Community providers, school districts, school personnel, it's really, really vital to health and development of your company to maintain good working relationships. Even if you don't agree, you can disagree and still have a good working relationship with somebody. And who knows, you might learn something in that process and realize you were wrong, which definitely I have been through. And being humble enough to accept that and realize that I too can be wrong in this situation, but I'm going to learn from it and become a better professional and a better company because of it. So relationships is huge, and developing and knowing where you're providing the service really drives what you need in place. So starting out in the homes and the community, we needed to maintain good working relationships. I needed to have technology systems in place to be able to take incoming phone calls, be able to meet HIPAA requirements, be able to hold and maintain files on digital files on clients, hold records for me. So it could make it easy for me as a clinician to pull that information up and have things readily available. Having a good team that can support you while you're working in the community. Often I'm in the community all day. Meanwhile, I've got parents sending me front and back of their insurance cards to call and sit online for 2-3 hours to get a hold of the insurance companies. I can't do that if I'm in the field working with clients all day. So while I was networking in the community, building my clientele, finding team members to come help me provide supports for our kiddos and maintain quality services, I need to have a team in place that can make those 3-hour phone calls and sit on hold for ages with insurance companies to readily be available to work with me. Or, hey, I'm sending you over this form, the copy of this child's IEP. Can you upload it for me? Like, I needed somebody on the back end to help me do those pieces. So, and then as I grew in placements or locations we were providing the services, my team needed to grow. So being intentional with that is the other piece you need to make sure you have in place. Don't promise things unless you've got a system to do it proficiently, which was hard. I have a really hard time. If I meet the child, I have a really hard time saying no, really hard time. And I flat out tell families that I will come and I will meet with you. I cannot promise you, but I'm going to tell you it's going to be really hard for me to say no, because I just love them so much when I meet them. But letting families know, having resources available is another big thing to have in your back pocket, because these are pieces that support your family and provide good quality services. Is what else is out there to help those families down their journey of raising a child on the autism spectrum. It's a lot. What other resources? As our service delivery changed, we needed more. We needed more type of technologies. I needed more staff. We needed more administrative support to support the staff. to support the ongoing and growing needs of the clients. So I think as you begin to move up in the different types of services or the locations of services you provide, you need to make those conscious decisions to pull in more people to help you grow. I hope that answered.
Yeah, you said that you pretty begrudgingly opened some clinics. So can you talk about
Yes,
where you started in terms
sure.
of things and services and how you ended up with these locations that you have now?
Sure. So it was, when I think back and I look at the progress of when we opened our center in Stewart's, we started in Stewart because it's my backyard. It's my community. There was very little to nothing center-based wise in the Stewart area. Palm Beach Gardens came later. And the reason why we opened Palm Beach Gardens is we have a huge referral system down there, and we were getting a ton of calls for the Palm Beach Gardens, Jupiter area. There was already several things going on in Jupiter, so we came a little further north in the Palm Beach Gardens area. So it just kind of met a need because we were getting a lot of little ones that needed full intensive services. So that's essentially why we started the Palm Beach Gardens location. The Stewart Center was first. And again, it was in my backyard. So it was, my community doing things to support the community I lived in. And the reason why I begrudgingly opened my doors for that was because I just love home-based services and I didn't want to be pulled away from that.
Mm-hmm.
However, I have learned that both has been very helpful and valuable to families. Having the option for both have really helped the quality of life of the families that we serve. For many reasons that I could, clinically get into for each kiddo, but in many ways, it's really pulled the families together and has created their own network. The families have become close. It's created multiple opportunities for them to meet out in the community and has increased their opportunities for peer engagement. I mean, there's just been a plethora of reasons why it's been helpful. It also helps staff, I've learned, having a center gives them their full-time hours that they are looking for so that you don't lose this really good, amazing team that you've spent time and have poured your heart and soul into building. They have the hours that they need to support their family. So it's kind of on both ends that it supports both parts of the company, which has been wonderful. It's funny, I think back when we opened the center, it was literally just before COVID. Which is not at all, of course, what you plan. You're not like, when do I open a company? Oh, right in the middle of COVID. Horrible timing. But I look back and I feel like it was just meant to be. We opened literally in 2019, this like just before. We had like 2 kids. So it was slow with word of mouth getting out and that kind of thing. And then in 2020, when that summer of COVID, so June, July, and August, we were slam packed with kids, almost to the point where we were like the bay that we're currently in, we were we were at the max capacity. And that's all we needed to like kick off, because then we just had regular kids the entire time after that. So again, I would have never chosen that time specifically or strategically, but it just happened that way. And I'm thankful for it.
I think that one of the questions you and I have kind of talked about outside of the webinar, and a couple of people have already asked in our Q&A, so I'm going to bring this up now. We have a high burnout rate in our field, and you've talked about kind of creating a community and providing this setting where your staff can maximize their billable hours. So can you speak to some strategies that you've implemented for retaining staff?
Great question. This is a very intricate question. There's a lot of variables to consider at retaining staff, because people come with their own things in their own life. As a leader, I think that for me personally, what works is to being a leader, I need to know who my people are, what their individual needs are, what do they have going on in their life that I can support them with, even if it's just a phone call at the end of the day, letting them know how much I appreciate them. And hey, I saw you did this today. I appreciate that. You went that extra mile to help that kid. Or to help that staff member, and I appreciate you. So we are and modeling that for other staff is really important. They see how to support their team, and then they in turn support their team that way. And then they feel part of a team and part of a unit. And the natural behavior for that is you don't want to let someone else down. And if you're all supporting each other, then coming to work on time is important, because you know somebody else is going to be filling in for you and you feel bad.
Mhm.
Or calling out just because you feel like calling out, you are less likely to do because you have a team member to support. So, but at the same time, I also know my staff well enough that I see you're going through a moment. You've worked your butt off today. Come in a little bit late tomorrow. It's okay, because you need the moment, you need a break. So I think as a leader, knowing how to balance that. And like I said in the very beginning, this is a very intricate piece, because you not taking advantage of that either is important, because we've had that situation where people will take advantage of it. So, but balancing it and knowing your people is really, really important. So taking the time to find out things they like. We have a lead RBT in our center who does a couple different things. She also is an RBT, obviously, but she also helps me with learning about people. We send out surveys every once in a while. What is your favorite kind of cookie? What is your favorite drink? What is your favorite thing to do on the weekend? It's our way of learning what people like, because every once in a while we send them a little treat in the mail, or we send them something at the end of the day, even if it's a bag of potato chips that they really like. Or I have one of my RBTs likes a very specific kind of chapstick, and I bought her a thing of chapstick yesterday. Or somebody forgot their lunch. I went to Chick-fil-A and got them Chick-fil-A for lunch. I had a gift card, and here you go, pay it forward to somebody else. So knowing your team, supporting your team, building a network together is really important. I think for ongoing staff retention, giving them opportunities to learn and grow. We also within our company have tiers of RBTs to give them opportunities for professional development. They can be a resource specialist and help create materials. They can be a case manager and help develop programs within Rethink, and they're trained on that. Of course, it's all overseen by a BCBA. Most of those RBTs are also students in the field of behavior analysis. And we also have something called a peer mentor, where our RBTs help check in on new RBTs that are starting with our company. How are you feeling today? What did you have a tough day? What can I do to support you? So we intricately build a team within a team to help support each other. If somebody needs to just walk away for a moment and take a deep breath, we support each other in doing that. Because I see you're having a moment. Can I take over for you? Sometimes a child might flail their body and somebody gets smacked in the nose and it brings tears to their eyes. It's just a reaction. Hey, I can take over for you for a moment. Go pull yourself together, and then you can go ahead and take back over again. So building a team is really important.
Yes, two of the things that I heard you say in a lot of ways is supporting each other, which I think as leadership goes a long way. A lot of us are only used to hearing from our boss when there's something negative or bad that we have to hear. So just taking the time as a leader to just check in and say something positive, I think it goes a long way. We have a gratitude board here at Rethink where our entire team has access to this document, and we share gratitudes with each other throughout the week.
Yeah.
And at the end of the week on Fridays, we have a team call where some of those are kind of highlighted in the call, just to really shout out the person and let them know what they did to contribute to the team that week. That was so
That's
helpful.
great. Yeah, I mean, we do individual thank you cards. We've left them anonymously on people's cars. I'll spend a Friday evening and either text or call people and just let them know they're appreciated. So it's a lot of work. 100%, it's a lot of work, but in the end, it's well worth it.
Absolutely. Probably better than continuing to hire and train staff all the
yes.
time.
And that's the other thing to add. So we have a newsletter that goes out monthly. In that newsletter, we also highlight things just in general that the team is doing. We welcome new people. We have ongoing professional development that we offer monthly for both RBTs and BCBAs. we'll put in there, and in each month is a different topic. Sometimes we try to stick to a monthly theme. Like in February, we did compassionate behavior analyst. How do we show what is the behaviors of being compassionate, which is really important to look at as well. So again, these are all pieces that lead to how do we support our team in their professional development, but also in their daily life, and just being there to support them. And then the other thing on that newsletter, which is important, we do team building activities each month as well. This month we're going miniature golfing together. So each month is something different.
One of the other things that you mentioned is just taking the time to get to know people on a personal level. And I think that also goes a long way in, like you said, kind of building collaboration and that team mentality, but also making sure that your employees become a person and not just a number. I know, unfortunately, we are driven by the billable hours that we are getting, and we can easily become a number in this field. And so it's nice to still have a sense of, working as a team and being seen and being heard, not just being a number.
And to add to that, being a number is really easy to walk away from. But being part of a work, we always say work family or a team. So being part of your work family is really hard to walk away from.
Absolutely. While we're talking about this, a couple of questions have come in around this topic. So sometimes hiring can be a challenge, especially when you are in an area that is so saturated with all of these ABA companies. So do you have any resources or recommendations for what's worked for you?
Great question. So I will say the opportunities to feel a part of a team and knowing how much support they have has been a huge attraction for people. They have some people that have worked in other places come here and say, this place felt so friendly, so family oriented. I feel like I'm going to learn so much here because there's so many people here to support and everybody helps everybody, has been a huge attraction. I know that I am not a big social media person, just going to say, but people will often send me screenshots of things on Facebook. And that has been a big topic of discussion when people have looked at ABAF, is how much they feel as part of a family. And that has been a big attraction for people that have come here. And to be quite frank, I would prefer not to have somebody who's really big with numbers and wants an extra 50 cents or an extra dollar. I would just say, I don't think we're the company for you. And I have said that several times, and I've turned people away because of that. We do have a rigorous onboarding process, and we also go over that to let them know how much they're going to get trained, how much support they're going to be provided during their time here in the beginning when they first start. And that also has been attractive to people.
Absolutely. The ongoing, well, first the successful initial training, but the ongoing trainings and support I think are really important in keeping people.
The opportunities for growth too. That's a big one. Like what else? I don't want to just be like stagnant in this same spot all the time. Is there opportunities for me to grow? So we got a lot of young RBTs that want to know that, like, can I grow here? And we go over that growth plan with them and let them know that there are opportunities and what those look like. And they do like that too. That's also another attraction.
It can be very difficult to build those opportunities in to a business model because, you have an RBT who is a lot of times going to probably go to school and end up becoming a behavior analyst, board certified, and hopefully you keep them if the 50 cents an hour doesn't appeal to them. But there comes a point where there seem to be sometimes a lot of companies where you might become a clinical director and then that's about it. And there's not really room to grow unless you want to start your own company.
That's right.
So can you speak a little bit more about the different types of roles that you have?
Yep, absolutely. So we do have clinical directors in both of our centers. The one in Stewart, actually, we considering her an associate clinical director. I'm a big advocate for not putting a brand new BCBA as a clinical director. I won't do it, or a center director. There's a lot to learn in that role. A lot of professional development that needs to occur on how to engage with families, how to manage a problem that has arisen in a very professional manner and in a compassionate manner. So that, I believe, takes a lot of time and development that not a new BCBA could probably handle all those moving pieces. So we have an associate center director here in Stewart, and I'm her supervisor. And then we have a center director in Palm Beach Gardens who's been a BCBA for 8 years, and has been amazing to have in that role. And then we also have more of a program director who oversees a lot of our program initiatives, and she's out of Texas, and she's been a BCBA for many years, 10 plus years. So those are kind of our higher level positions. And then we have, of course, RBTs, and then the 3 roles I mentioned earlier, which is our peer mentor, our resource specialists, and our case managers, which are more our students right now. And we have our scheduler who works at our front desk at the center, and she manages the schedules company-wide. And then, of course, we have HR is one of our other roles. And we have a business consultant that we work with as well. I think those are our main ones. And then, of course, our BCBAs as well, who are a big chunk of our leaders.
Do you have any incentive-based programs or any performance bonuses or things like that you incorporate?
Yes. Great question. So those are built into our offer letters that we present to our behavior analysts. So yes, we do. Typically, we've done it in a couple different ways. We really do it based off of what that individual is looking for. Everybody has different reinforcers. So we work directly with that person to design incentive-based programming that's specific and unique to them. I saw some questions come up in the Q&A. I hope I am okay to answer it at this point. Questions on billable hour requirements. Most places, and we're similar to that, anywhere between 20 to 25 hours billable. We understand the flexibility in this world of behavior analysis. We provide services to kids, not t-shirts, is what I always say. So the needs change. They get sick, they go on vacation. I totally get it. So we are flexible. We have something called a weekly reflection log that we utilize with our hourly or our employees that are set up in positions where they're salary based, to help them remember and give some accountability on how many hours did I work this week and how many hours did I work that week. And we keep track of both billable and non-billable because both are important. Non-billable means they came to our company events and our professional development opportunities, which are vital to the health of our company. Non-billable also means they may have stayed after and helped support another learner that was in the middle of a crisis and they couldn't bill for it because it wasn't their client. That's also vital to the health and the safety of our clients and our team members. So we keep track of both. And we consider it a reflection log. It is not a mandatory push, if that makes sense, but it is something to help us keep accountable.
Absolutely. And I do think it is important to track the activities of that non-billable time versus
Absolutely.
just seeing that it is not billable.
Yes, and we do that as well. Yeah, absolutely.
I would also like to go back to the mentorship program that you've mentioned a little bit. So can you tell us a little bit more about what you've developed and how you're implementing it?
Sure. So at the start of the mentoring program, first of all, we have a cap because it's a lot of resources to support our students. And we want to make sure we're doing a really darn good job to give them a really robust opportunity to learn about this field and all the different facets and variables that are involved in it. It's a lot. So we kind of broke it down into a different process. It's actually something that we're refining currently because we found there were some additional needs that needed to be added to the process, but I'll give you a brief overview. So when somebody says they're interested, obviously they need to be enrolled in a program. They have to fill out an interest form. We meet with them individually. We go over their own professional development goals, which we understand will change because they're a new student. Their perspective is going to change. Their needs will change. But it helps us to kind of see what they're looking for to get out of this relationship. We, of course, enter a contract with them. We have, we're in the process of, we have PowerPoints for everything. We're in the process of recording those PowerPoints. So part of that is they'll get a video that explains their role as a student in behavior analysis, and their role as a student within ABAF, and what does that mean for them. Each PowerPoint is approximately 45 minutes to an hour long, so it's short, but then they have a homework that's assigned to it, and it counts as part of their field work requirements. They have a log. We have a notebook that's all kept on both either digital or printed, whichever they feel most comfortable with. We use Teams, Microsoft Teams. They each have their own individual team that is assigned to them and a supervisor. And that's where they upload their verification forms, their logs, any homework assignments that they're assigned, any journal articles they need to review, and then write up a paragraph of how they're going to apply this to a specific client. So they have, we go through, they have like a worksheet that they're given that explains their expectations. We developed a checklist for that, so they understood daily, weekly, monthly, what their role is. It has like hours of expectations in there, and just helps them understand very clearly what they need. Then they're given basically what their lessons are going to be, their monthly meetings. Each month is a different topic and what that topic is going to be about. And then they're assigned as a case manager to 1 or 2 clients, depending upon their ability, their capability at that time. So if they're a brand new student, they're going to get 1, just they're learning. Then they go through a training on how to use Rethink, and we basically BST it. So we give them, we have a mock client. They have to go in and add a program to that client so we can see they know what they're doing. And then we work with them very closely with a client and walk them through that process on how to add programming. We have a digital log. We use OneNote, where they put all their thoughts and their ideas in OneNote, and they work closely with a supervisor on that, program changes that they think need to be made, what targets they think should be added. Then a supervisor goes over it with them, and then they work together to put it into Rethink. And they maintain that, right? So that's their job, essentially, and their role. Mostly all BCBAs have 1 or 2 case managers that they oversee. So 1 or 2 students that they're in contract with. And it just depends on that BCBA and what they're able to handle or agree to. We don't want to overload them, but they're also part of a team to help them, support our students on site. That's a brief overview.
Yeah.
But there's a lot with that.
I'm sure, but just the investment that you are putting into really helping grow your staff, I think, is an important distinction, where you might have those companies willing to pay 50 cents more an hour, but you're actually investing in their future growth. So
absolutely,
I think that's an important way that you can look at retaining staff.
Yes, absolutely. And it's important to our field. To the health of our field. I've seen a lot of BCBAs, new BCBAs, that just don't have the field work experience that they should probably have to be a really good, robust, well-rounded BCBA. So, and it's a lot to take on, but it's really needed in our field, because at the end of the day, it impacts families and it impacts these kids that we're providing services to.
I want to take a different route now and kind of go back to the community and clients. I know we had a question come in about getting referrals, and I know that you have talked about the importance of really building relationships with area providers.
Yeah.
Can you talk a little bit about your relationship and why that's so important?
So first, I think it is really important that this must be a top-down communication, meaning that not just Jen can think that it's important to collaborate, communicate, and refer to other providers, but so must every other BCBA within my company. So we work really hard together as a team to make sure that's heard loud and clear. I don't hoard clients. There is way more clients than there are providers. So there is plenty to go around, and we need to look at what's important for these kids. If they're in crisis, they need help now. I can't do it. I don't have the staff. Who else is in the area that I can provide you support with? So having that communication and training your staff to have that perspective is really important. So that's number one. Number two is working closely with your intake person. So I have an intake specialist that we work with. She deals a lot with the families. And if we can't provide the service, she works with me on what other company can we refer this client to. So her and I work together on that based off of the client needs. So I've been in the community a lot. I know a lot of providers. I know a lot of companies down south and further north, mental health counselors, speech language pathologists, occupational therapists, social skills groups, etc. So she'll call me and say, we can't take this kiddo. They live in off of North Lake. Is there a company nearby that would be really good at providing their service? So her and I work very closely on making those referrals out. Sometimes family choose to wait. They're not in crisis. They want to wait. They're fine waiting. Great. But we check in on them every once in a while. Have things changed? Do you need help now? Sometimes families don't think to come back and call and be like, okay, it's changed. I really, really need the help. They're used to this. They live in it every day, and they forget to speak up sometimes and ask for help. So I'm very big on, if our clients are calling, they're in crisis, we need to provide the help, whether we can do it or somebody else can do it, but we need to get them help. So I'm really big at the resources, who else is out there. I worked with the Center for Autism and Related Disabilities through FAU, which is a grant funded through the Department of Education. And that's primarily what I did for 8 years, is find what other resources are out there to provide supports for families. So I'm very in close contact with them. And they have a really good list on their website that I'll refer families to. I'll have families call and say, like, there's 20 speech pathologists on this list. Can you give me 4 that you know of? So we'll help. We have families that we help find resources to that aren't even our clients, that are in the local area, that they call us because we help them find resources. So I think, yes, again, it's a lot of time, but it's so needed. And this was something I decided needs to be a part of our company. When we started, I wanted to have us, when we started opening the center, that's how I wanted our center to be different, is that we'll provide support to the family within reason. Obviously, like, I can't provide them direct services if they're not our client, but I can definitely help you, let you know what other resources are out there, or put you in contact with somebody. I'm happy to do that. And I always tell families, call back if that person doesn't work out for you. I'm happy to help you find somebody else. So it's important, because even though you as a company aren't able to provide the service, you're still impacting the family life and the community as a whole.
Exactly. And that's ultimately what it's about. We have to make money as a business, but it's the child and the family that is in need that is the first
Absolutely.
and foremost.
Yeah.
I know you've mentioned a couple of times that you use Rethink, and that is even part of kind of working into this mentorship program, getting people to create programming and things like that. So for any of the attendees who aren't aware, part of being a member of our startup community is getting access to a sandbox account in Rethink, where you can kind of go in and play around in our platform to see how you can use it to create programming, collect data, schedule appointments, and bill out for those services. Can you speak a little bit about how ABA Foundations is using Rethink, and just any recommendations that you have for people who may be new to Rethink?
Sure. So currently we are using, of course, the program library and everything that has to offer, which is amazing, by the way. We've done a lot of in-house custom-based programming that are tied to assessments, which has been very helpful. Because if I've got our, students going in and adding programs, They're pulling from a library that have been custom made often, and then tweaking to meet the needs of the individual client, but it makes it systematic. So less room for errors. And then of course, we also use it for the medical necessity assessment. We use the graphing components of within the system. The funder reports have been huge time saver. Thank you, Rethink, for that. Huge time saver. We also have been using, you guys have a fantastic platform for professional development in all your videos for trainings. The RBT training platform has also been essential. We use that, but then we also add our some other live pieces to it. So we do almost like a BST. So watch, then you're with a client and a clinician and you're practicing it, which has been very, very helpful to do that. Goodness, I'm trying to think what other platforms within Rethink we use. Of course, the billing side, the scheduling, all of those pieces we use as well.
For anyone who is interested in learning more, I am actually putting in the chat right now a link to that startup community if you want to learn any more about that. I know we have a few minutes left, so I think my final question before we open it up to anyone else in the audience is, do you have any final advice for clinicians who are interested in starting their own practice that we haven't already discussed?
Yes. Be intentional when you set up. Don't get too far ahead of yourself. We use, which I could talk forever about this too, but we use something called Planning Alternative Tomorrows with Hope, which is a way to set goals. And we use that in-house, and we do this as a team approach. This helps us set long-term and short-term goals within our agency. And don't forget why you do what you do. You started in the field serving kids. Don't let the grind of the business take over that perspective. Stay humble and compassionate. You're a BCBA first. Serve your kids first before anything else. And those are my big take-home points.
Okay, I lied. I have one more. I am a huge Friends fan, and I've been noticing your shirt. So can you tell us a little bit about that?
Yes. So this year we did our own in-house conference. We called it the ABAF Friends and Family Summit. And this conference, it was a virtual. We used Connections Behavior. So a shout out to them, an online virtual platform for CEUs. But we specifically chose CEUs, and I sent out options to choose with a focus on being compassionate, serving clients, and working collaboratively with other providers, which is the Friends part. And we did a big theme on the Friends series, and just a big focus on supporting each other, supporting our community, supporting our families we serve, and also collaborating with outside providers. So that's why I wore the shirt today, just to kind of do a big push on that. And to speak off of that, the other thing is have a mantra posted. Mine's long, I tried to shorten it. But one of the pieces and we have this in both centers set up so people don't forget that we need to encourage one another, be patient, put others before ourselves, smile and say hello to people, like greet. We're here in a service field, so don't forget we are serving. We're accepting one another, trusting each other, forgiving, and above all, being compassionate and loving to each other. And it's important when you work in the same space all day long, every day with each other. Everybody's going to have their moment. Everybody needs a break. Everybody has a bad day. We all need to support and help each other. So that's my friends and family spiel.
I love it. I'm already brainstorming ways that I can use Friends themes.
Yes, there's so many fun ways. Yes, there are fun ways. Yeah. Good
All
question.
right. If anyone is interested in learning more about ABA foundations, I just put a link to the website in the chat, so you can grab that one. And we have about 10 minutes left. So if anyone has additional questions that we have not already addressed, feel free to type it into the Q&A now. While I'm giving you a couple moments to do that, we do have another webinar series called Our Next Guest. And that one is with Dr. Bridget Taylor. She sits down with a variety of people in our field and talks about a lot of different topics in ABA. So that is a CE event. The next one is going to be on March 16th with Dr. Dennis Reed, and he's talking about maintaining motivation and work productivity as behavior analysts and practitioners in the field. So hope you guys can join that one. Susan is asking, do you have a billing manager? And I'm assuming, Susan, that question's being addressed to Dr. Agganis and her ABA Foundation's company. Correct me if I'm wrong, but Jen, can you maybe speak to that a little bit?
Sure. Yes, we do, to answer your question. She does all the billing. We take everything from Rethink and we use Cario on the back end. And she pulls from that and pushes into Rethink on a weekly basis and manages any billing snafus that come up. Her and I work directly together on any contract issues with funders, which we have definitely had them. Anytime you transition from, for example, United, we are in a group contract, for example. So anytime we shift from one contract to the next, there always seems to be a problem that her and I have to work through together. So definitely.
So Rethink, just to kind of piggyback off of that, does offer a couple different billing solutions. One is keeping things in-house and using Cario through Rethink. We also have billing services where you can outsource to our team. The next link that I put in the chat is if you want more information about either of those or Rethink in general, you can talk to one of our team members if you follow that link. Another question came in from Ashley. How do you go about beginning to build community relationships and connections with other providers?
Great question. Attending IEP meetings is one big way. Reaching out to other providers to help find resources for current clients. Taking a moment to meet up with them for coffee. I've done that as well. Help them. So I've not that long ago went out to dinner with 2 other company owners of other ABA companies and just brainstormed together on how to overcome barriers that each of us were having in different ways, and we all helped each other out. I regularly might get text messages from a couple company owners that are brand new, like, hey, we're having a problem with this funder. What have you done in the past? I might have a contact that they can reach out to that they didn't have, that I've spoken to many times or have a relationship with. So taking an extra minute to listen and spend time with them is huge to any type of provider. I hope that helps answer your question.
Kimberly asked how many clients you serve in the center locations, and are you funded primarily through insurance?
Great question. I think we probably have a pretty even balance between Medicaid and private insurance. I would say depending on our center location, one is more Medicaid heavy and one is more insurance heavy. And that just has to do with the demographics of the area. So I hope that answers that question. Our Stewart location is transitionary right now. We had a couple kids at the beginning of the school year. We transitioned out 6 kids into school full time. 1 of 2 more just left. So we had spots opened up and we filled them immediately. So to answer your question, we have anywhere between 15 to 20 in our Stewart location. And then we have also afternoon kids, and that's during the day. And then we have a whole other group of kids that come in the afternoons. In our Palm Beach Garden Center, we have less because that's a brand new center. We just opened up in September. So we have 7 during the day, and then we have about 10 after school. We also run social groups, which has been a big way to bring in some other, other different demographics of kiddos and meet other kids' needs. And we have a really good social skill group running, which has been great. And it's been a good learning opportunity. We use the ACT and AIM program as well as the zones of regulation paired together. Based off of needs for those kids. Medicaid referrals. I saw that one come across. Yes, we do provide services in the home still as well, Kimberly, and in the schools. So Medicaid referrals, pediatricians, pediatric neurologists that are Medicaid providers themselves is one way. I have done lunch presentations at doctor's offices, spoken with them on the phone. We collaborate a lot with pediatricians or diagnostic physicians on needs and treatment during the intake process. If they were referred from a specific doctor in the local area, I might pick up the phone and call that doctor and say, thank you so much for your referral. I see that you referred this client. Is there anything specific that we need to know about treatment? We're happy to serve the family. So I've done that. And that's another way to continue ongoing network opportunities to meet those providers in your area. Bring donuts. They love donuts and coffee. They love subs. And then we send thank you baskets for referral sources every year to thank them. Sometimes I go out to dinner with them to get to know them more and what their practices are like. What can we do to support you and your services? So I've done a mixture of all those things. I hope that helps.
One other question, and I think it
You're welcome.
partially has to go back to Medicaid, but in general, any strategies for individuals who maybe call out often, take vacation all the time, because
Question.
like with Medicaid, a lot of
Yep.
these last minute cancellations, you cannot provide that
Yeah.
for.
Yeah, great question. So we have definitely had that issue. We have an action plan in place that we typically do with families, of course, communicating with them upfront right off the beginning is going to be very important, letting them know why intensive services are needed. I love how Aaron, right before our conversation today started, we discussed using the medical necessity assessment as part of parent training. That the medical necessity assessment is on Rethink. And that sounds like a great plan because they can see, it allows the family to see the variables that impact treatment for their child. Why are we even providing this service? It's not a babysitting service. It's not a school-based service. This is medical treatment. And the way that your child is going to be able to show progress as quick as possible is to have integrity with our treatment and making sure you're on time and that you're regularly here. And when you miss, these are the things that you're missing. And definitely one of the characteristics of children on the autism spectrum is to show signs of regression when they're not here. And now they're regressing in services and are regressing in skills. And we need to now address that. So educating is a big piece of that, especially with newer families that are in the field of ABA. And even making sure that you get the doctor, treating physician to back you up. Also, I've had to do that a couple of times. And sometimes just talking to the family, what is the barrier to you being here on time or to you readily coming on a regular basis also has helped. I've had some families that they've also been going through their own medical issues and having a hard time bringing their kid to the center. So then we said, would 2 days a week at home help you? So now they're only coming here 3 days a week and not 5 days a week. And that family's like, yes, oh my gosh, that would help me so much. Great. We'll come to your home 2 days a week. And then the other 3 they'll come. So it's less driving on you. And that has helped them too. So those are just a couple of things to give you some ideas on.
Again, just getting to know them as people and understanding what their needs are in the moment, which could change from day to day, month to month.
Which takes regular communication and checking in with those families.
Exactly. Yeah. I know that we are almost at the top of the hour. So just quickly, if anyone is interested in learning about the medical necessity assessment that we were just talking about, my email is in the chat. So feel free to email me and learn more. If anyone's attending APBA next week in Seattle, we are actually presenting on our M&A tool on Saturday afternoon. I think the title of that talk is Translating Medical Necessity Criteria for ABA Providers. So come check it out or just email me if you want to talk more about that. Dr. Agganis, thank you so much for joining today. I think you had a lot of valuable strategies, tips, suggestions for everyone. So I hope that everyone that was on the call got as much out of it as I did. One last follow-up, you will receive an email, I believe going out tomorrow, that will have the recording link on it. It will also have all of these links that we've put in the chat, just in case you missed them. So you have lots of resources coming your way if you need access to them later on. But thank you all for joining, and I hope you have a great rest of your week. Again, thank you so much, Jen, for your time today.
Of course, my pleasure. Thank you, Erin, and thank you, everyone. I appreciate you.
Have a
Keep
good
up the hard
afternoon,
work.
everyone.
Bye.
Bye.